I am going to present my thesis on the topic clinical profile of newly diagnosed DVT in cancer patients of tertiary cancer care center. Introduction. Deep vein thrombosis is a blood clot that forms within the deep veins. Risk factors include reduced blood flow, increased venous pressure, mechanical injury to the vein, increased blood viscosity, and increased risk of coagulation. Cancer-associated thrombosis is influenced by a number of cancer-related risk factors including cancer site, cancer stage, histological subtype, time since diagnosis, and chemotherapeutic agents. The aim and objective of study is that to study the association of DVT with type, site, and stage of cancer, and to study the time interval between the diagnosis of cancer and development of DVT. Materials and methods. The study was conducted after the approval by the Ethical Committee of MOH Hospital, Ludhiana, after signing the informed consent by the patient. This is a non-interventional cross-sectional observation study. The study was conducted in OPD, wards, and ICU of MOH Hospital on cancer patients newly diagnosed with DVT. The study was conducted in 50 patients. Inclusion criteria. All cancer patients presenting to OPD or admitted in ward or ICU with suspected DVT and screen positive for DVT using screening investigations. Exclusion criteria are patients who are already on anticoagulants, patients who are already diagnosed of DVT, already diagnosed as a case of pulmonary embolism. Methodology is that identification of patients with symptoms and signs of DVT, screening of those patients for inclusion in the study, informed consent from patients and recruitment in the study, finding out the risk factors, causes of DVT, and treatment given to each patient as per performer. Data entry was done in Excel and descriptive statistics was used. Final report was read. The results was that the study, which was conducted in 50 cancer patients with newly diagnosed DVT, observed that adenocarcinoma is having more risk of developing DVT when compared to squamous cell carcinoma. Most common site of cancer causing DVT is cancer breast followed by cancer ovary. The usual time of development of DVT is within 1 year of diagnosis of cancer. This pie chart shows that adenocarcinoma has 29% of development of DVT. This bar chart shows that about 30 cases out of the total 50 developed DVT. Time to diagnosis is DVT is usually seen less than 1 year after the diagnosis of the cancer. Conclusion. DVT is one of the common complications seen in cancer patients. Early identification of symptoms, proper screening, and diagnosis followed by treatment can decrease the mortality and morbidity. Prevention of DVT is important in at-risk patients. Thank you.
Do you recommend using prophylactic treatment for DVT in all cancer patients?
Sir, in my study it was found that CA breast, CA ovary are having no risk of developing DVT. So if such patient come...
Unfortunately, the fair sex is more involved, no?
Yes.
Because it's both ovaries as well as the breast, you see that the maximum incidence you see.
Yes.
So you don't recommend sort of a prophylactic treatment for all of them.
Yes, sir.
Thank you.
Thank you, sir.
Thank you, sir. Now I would like